Hello everyone, welcome back to our video series. My name is Ana Chavez Mancias and I am the Program Specialist for the National Hispanic and Latino Addiction Technology Transfer Center. Thank you for joining us today. In today's video, we would like to discuss harm reduction and its importance, and break down some of the stigma often associated with this topic. According to the National Harm Reduction Coalition, harm reduction is defined as a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. They also believe this is a social justice movement aimed at the rights of people who currently use substances. Harm reduction is a way to meet community members where they are at based on their needs. To put it simply, let's talk about what other daily practices can be considered for harm reduction outside of substance use disorder and opioid use disorder. For example, did you know that wearing sunscreen is a harm reduction technique? By wearing sunscreen, you are preventing the development of skin cancer or just preventing a very painful sunburn. Did you also know that speed limits and wearing your seatbelt are other harm reduction techniques? We want to avoid traffic accidents that can sometimes result in deadly consequences and want to ensure community safety. Being physically active is another harm reduction technique to prevent the developing chronic illnesses that result from not moving enough and to avoid developing a related disorder or illness, such as diabetes, obesity, cardiovascular disease, depression, and anxiety. Let's continue with harm reduction involving substance use disorder and opioid use disorder. According to the Substance Abuse and Mental Health Services Administration, SAMHSA, in 2018, 1.7 million Hispanic and Latinos engaged in opioid misuse. The Center for Disease Control, CDC, stated that the risk of overdosing on prescription and illicit opioids such as heroin, oxycodone, hydrocodone, codeine, and morphine is exceptionally high, with an average of 136 deaths per day. In 2019, over 70% of the 70,630 overdose deaths in the United States involved an opioid. To make matters worse, synthetic opioids such as illicit manufactured fentanyl have increased since 2018, adding to the increase of overdose death rate. The first step of harm reduction is knowing the signs of an opioid overdose. Opioid overdose signs include unconsciousness, tiny pupils, slow or shallow breathing, vomiting, inability to speak, faint heartbeat, limp arms and legs, pale skin, and purple lips and fingernails. Fortunately, a medicine used to reverse the effects of an opioid overdose known as Narcan or naloxone aids in harm reduction. Narcan can be injected into the body using a needle or nasal spray, and once injected, it attaches to the opioid receptors and reverses or blocks the effects of opioids. This medicine is truly a lifesaver. We also want to expand upon other harm reduction methods such as syringe and needle exchange programs for disease prevention. There are numerous reasons why a person injects drugs. Either way, it is essential to prevent the transmission of bloodborne pathogens and diseases such as HIV and viral hepatitis through free, safe, and sterile syringes and needles. These community-based programs provide access to clean needles and syringes and safely dispose of used ones. They offer additional services and resources, including referral to substance use disorder and mental health treatment programs, care and treatment for HIV and viral hepatitis, education about overdose prevention, vaccinations, and screening for sexually transmitted diseases, STDs. Lastly, let's discuss the buddy system. The buddy system is a harm reduction method in which individuals are paired to ensure each other's safety. While using drugs, it is critical not to use them alone in case an overdose emergency. A buddy can save a person's life by providing them with vital support and services such as Narcan to reverse an overdose's effects or call 911. According to the National Conference of State Legislatures, there is some form of Good Samaritan Law in 40 states and the District of Columbia, which generally provides immunity from arrest and charges for certain offenses related to drug use or possession when a person calls 911 for an overdose, they witness, or someone experiences an overdose. There is no shame in asking for help from a friend, especially if your life depends on it. Thank you for watching this video. Remember, you can find the same content in Spanish and Portuguese. Come visit our pages next month for the latest content, and we invite you to join our Juntos network to get a first glimpse at our upcoming events. Please share it with your family, friends, and colleagues. Stay safe, healthy, and remember, we're all in this together. Until next time, thank you.